Okay, hello everybody. Uh, Happy spring and welcome to our CHE210 nutrition check-in. And so we have this is in preparation for uh, exam four of five. This exam includes content from chapters 12 through 15, and that's water and major minerals, trace minerals, physical activity and body adaptations, and the first of the life cycle nutrition segments, and that's pregnancy and lactation. So as I tried to remind us all the time, we're trying to make connections. Everything builds uh, on the knowledge and thinking and curiosity through the course. We're learning about the nutrients, how they're used, how we get them, um, how we may not get enough of them, what might be consequences of not having these at the right times and the right amounts, and how we can always do better, and um, how might we find out if we're doing the best? Do we have optimal nutrition and reaching our potentials? Um, and hopefully, everybody's getting a lot out of this, learning about themselves, learning about the material, uh, and how to take best advantage of the knowledge, and hopefully use that if you're in or going into healthcare or related. This is very important. And us as individuals, it's also very important to have at least this level of knowledge and thinking through the area of nutrition and health. So let's see on this slide, another reminder, mind tap activities. They're important to go through as best you can. Watching the clock, getting through them, getting as many points as you can. Uh, they're low points, but it adds up in the end to 25% of the grade. And on Blackboard, you can monitor how you're doing and accumulating those points. And as many students are doing, if there's an issue comes up and the door closes on some of the mind tap, just let me know, tell me what the issue is, and try to accommodate so you can get through those, open it up for a day more, 2 days more, because that's really is to help you. The upcoming exam, same same format, about 38. I get there 38 questions, and I try to keep it the same for all the exams, mostly multiple choice, maybe some true false, and then 6 short answers, short essays. I do want to remind everybody to take the time with the essays, short essays, and don't try to be super brief. By that I mean half a sentence or a phrase. When it says discuss, that means to write some proper sentences, a few sentences at least, 3 or 4 sentences, maybe more, but to really take some time, be thoughtful in answering them. That's usually I'm grading them out of, I'm looking for key words, key phrases, yeah, but I also want them to be put in context, that I don't have to put together the whole picture. um, for you. That's a good job on an exam. Okay. Uh, uh, and I try to also is remind you about graphic organizers. Very important. If you're keeping a notebook, that's terrific. But how do you try to retain or to digest new information? Graphic organizers does wonders. Um, and I suggested one of those for all those details around vitamins, and now we have minerals, a lot of details, and it's best not to randomly just go back to text or whatever, but to actually take the time to organize them in a way that's good for you to learn and digest and maybe look at the same way that you put it together all the time. It helps you learn things. In the course, we're down there, so showing this is in the syllabus. Always, when you have a question, if you haven't, not necessarily to print out the syllabus, it's a good idea if you can, but also once in a while check, do a time check. Here we are, 16th of April. So mind tap, you should be in or completing the mind tap and reading and thinking about this chapter 15, the first life cycle chapter. Um, and okay, and so we have the exam coming up the end of the week, the 19th to the 21st. Again, it's open. One seating using lockdown browser. If there's an issue that comes up, immediately let me know in an email. Do want to say there are some people that are not taking some of the directions in lockdown browser seriously. It should be in a decently lit room or somewhere where um, that as I look and check the video, I just do a quick scan to make sure that it's you taking the exam and that nothing obvious looks um, uh, suspicious and counter to academic integrity. That's what I'm check for. That's what the uh, the lockdown browser is for. So show that you're please be compliant with this. I wanted you to be successful and not have any question of uh, whether your exam taking is authentic. Thank you. So one exam after four, that's in finals week. It's those last four chapters. It's not truly it's not a comprehensive final, although again, especially chapter 18, that really pulls together a lot of what we've learned, that chapter 18, disease prevention. Okay. As you probably know, all your courses, if you're taking how many you're taking, there is now course student evaluation. So that's where it's uh, your voice is important, and a series of questions asking you about how your courses are going and suggestions for improvement or what you like, what you wish would be improved. Right? Your responses are completely anonymous. Instructors don't see them, certainly not with names attached to them. We never see that, but also we don't see it until about a quarter or so into next semester. So there's no connection with your with your responses. So please take the time to participate in that. survey/evaluation. Appreciate it. Okay, the discussion, very interesting responses. I thought this was a very interesting, thought-provoking little short piece in Journal of American Medical Association, which often has uh, very very interesting. Actually, this was, I'm sorry, this is not JAMA. This is Nature Medicine. Very also a very prestigious journal, and talks about this campaign sort of bringing back this idea that which was stated early on by the beginning of medicine, saying food is thy medicine. Um, and how can we bring this back? How could people realize how important this food regime, food eating pattern is to our health, even more probably than we realize and have documented and study, from the microbiome to just hydration, simple things like that, but even more complex things, having a synergy of nutrients in our body, so that this wonderful machine we have work best. Also in resisting and defending against intruders and disease, and even if we have in our genetic makeup something that could be triggered as far as disease, that we have some kind of defense, that we keep our immune system uh, in shape and ready to fight off things, and have repair systems ready to repair and not be vulnerable to um, attacks or anything with long-term consequences, chronic disease, etc. Um, so I'm very interested in reading your responses. I'll combine a bunch and probably put something out, not identifying, but for everybody to appreciate. You are reading many of your fellow students' responses, and I hope that that keeps it interesting, some interaction among students in the class. Okay, that's all I'll say about that. And more and more physicians, especially specialists for like endocrinologists, and others, taking this seriously, and thinking about how do you make a prescription for good food, good, and checking your um, uh, dietary patterns along with activity patterns for health. Okay. Processed foods. That's one of the things that should be in a discussion all the time. How much processed foods do we take in? Is that real food? And how much does that take away from real food? And this is in your book there, unprocessed food, and then a similar kind of processed foods like milk, meats, vegetables, and fruits and grains made into processed foods on the bottom of this figure, and just taking one nutrient exchange, or two nutrients that we do need. These are uh, minerals, and ideally we get a certain ratio of potassium to sodium. As you can see at the top there, potassium in purple. In real food, unprocessed food, potassium is much more dominant. And then when things are processed, processing adds sodium, mainly as sodium chloride or table salt, as a preservative for processed foods, and then becomes a dominant of the two, sodium. And sodium is a nutrient that most people get much more than they need. In fact, sometimes a troublesome amount, and it does affect our health in a variety of ways, having too much sodium. Uh, and that's one of the things that when we're doing our diet analysis, our eating pattern analysis, using the diet and activity analysis in the beginning, or if you're continuing to do more uh, more input to that, we do want to look at the sodium intake. Is that below the amount, which is more favorable than way above the amount, this 2,300 or so milligrams? It's something to look at, and then look at how much are we eating in processed foods, because that's where a lot of sodium appears. And maybe you want to somehow change that back into the real foods, the unprocessed foods. And cooking for yourself, really important, because you know the ingredients you put in there, and it's fun, and you can impress others of your skills in the kitchen. I think I may have shown this before also. Understanding how we can analyze a food item is important. For instance, just looking at ingredients, is we know that the major ingredients, higher amounts are first in a list of ingredients, and then of course we can go further and look at the nutrition facts, which we should be very familiar with, and bring this up the Beyond Burger, which is the meatless burger that's made out of other things, soy, and we can compare them if you're curious about it. We taste the flavor, but you also look at the nutritional content, and it's we can do that. And I may have mentioned this too. If you want to continue later on with doing some tracking of your uh, eating pattern, uh, this is a nice free app that I found only recently. It's not very old. It's out there for a few years. You see on the bottom. Um, no, it's not the thing. But I had email conversations with the group that put this together. A few MDs, a few uh, really good IT folks put this together, and it's a nice program. So it's one that you might want to connect with. It's my food diary, my food diary dot com, I guess, and it's free. You do have to make a um, put your name in and all, and they want you to buy the more premium. You might want to, but it's using the simple free version is fine. Uh, okay, so study aids. Hopefully, you've been finding these um, helpful. The ones that I keep suggesting are really good to look at. Just to remind you, I'd show a few here, but it's in additional resources module, or where you find this. The Whitney chapter study guides is one, and then the yeah. It has two types of study guides, and this one is really good. I hope that everybody's finding this and looking through this before exams, and uh, really nicely done. As I've said, this used to be in the book, in the main part of the book, but they took it out for some reason. But I find it very good overview of the content, um, concise, and helps you think through everything that you should be learning. It's not a substitute for. It's not don't use it as a cliff notes and not do any other work and expect to have a great understanding of everything. But it's good. Here's chapter 12, water and body fluids and minerals. So an important concept that always is on the exam and very important is this process of osmosis. You should understand that. That's the movement of water across semi-permeable membranes. Semi-permeable meaning that the solute, whether that's cations and anions like chloride or sodium, don't necessarily pass uh, the the membrane, but it's water that moves back and forth. And it's a chemical principle that uh, everything wants to reach equilibrium. That's the lowest energy state. So if you have concentrations inside a cell, outside of a cell, it wants to equilibrate concentrations of given solute. Those things dissolved in the matrix, and that's water for a body. So the movement of water does that. So it moves to try to decrease. For instance, if a high concentration on one side, the water will move to that side to dilute the concentration to equal the concentration on the side where the water is moving from osmosis. So, and electrolytes, major minerals, etc., are participants in this keeping water balance. And that's important to keep us hydrated, not to keep cell integrity intact, that sort of thing. So there's many. So water, first of all, is of course a very important nutrient and keeping things in balance. We have some hormones involved in water balance in addition to the anions, and this series here of the main actor is that we've probably most commonly is the ADH, antidiuretic hormone. So diuretic that we know is to water is removed, lost from the body, and antidiuretic means retains water, and it retains it by retaining some solutes, retains sodium in particular. That's the bottom of the cascade of hormones and enzymes that you see in this graph. And we have great mechanisms to sense low blood pressure, and then when blood pressure is where it is in the range that it should be. And we have other actions that happen that's constricting or dilating blood vessels that help us maintain water balance. Another thing with water is buffers. So buffers are substances that keep aqueous aqueous media or aqueous cells or vessels or whatever, keeps them at within a prescribed pH range. That is the hydrogen ion concentration. And that's very important for the action of our enzymes, really important to be within the optimal pH range. It's important to keep pH within a range so it does not perturb or degrade or kind of literally bend proteins out of shape that they lose their function. So pH really important, and buffers help achieve and keep the pH range in the sweet spot. Some of the buffers in our body, the main protein one is main protein one. Well, first the main chemical equation that keeps us within pH range. That's the carbonate buffer, carbonate, bicarbonate, and carbonic acid. That pH buffer is very important. The other are certain proteins that are in the common in our blood that keeps pH within the proper range too. Okay, so that was water and uh, the major minerals. There's only a few major minerals, and we call those not because they're important, it's because of the amounts that we need to take in our eating pattern. Those major minerals are calcium, phosphorus, and magnesium. Calcium, phosphorus, and magnesium. Those are needed in high amounts, a lot of them mainly because they are important for bone health. Bone is constantly being remade. Old bone is kind of dissolving and then being remade to keep bones healthy and strong. The rest of the minerals, minerals we could tell them because uh, they are on the periodic table. They are elements on the periodic table. So elements like iron, zinc, and those are the two that immediately comes to mind. Then you have ones of lesser amounts, like manganese, fluoride, chromium. Of course, you don't have to remember these and state them, but for each of them, you should have an idea of where we might get those from. Many of them we get from either meat or greens, vegetables, and no singular food item has all of them. Um, and but we could say that meat uh, has the main of the trace minerals from meat. We could say, okay, iron, really healthy and healthy amount of iron, and zinc, and let's see, magnesium, and then a lot of the others come from plant makeup. So that's why we go for balanced diet, not all meat, not all vegetable necessarily, or if we're going all vegetable, we have to make sure that we get a certain amount, a good selection of vegetables to make sure we cover all nutrients. If we're just going either all vegetable or all meat, have to be aware of which we might be deficient in if we go one or the other fully. One of the graphic organizers I suggested was to do something like this, and it's a good learning tool, not just for our test, but you may want to remember, and by seeing and putting together something like this, or you can purchase one of those study fold laminated of particular topics. There's a couple of good ones for nutrition that has this kind similar layout of all your vitamins and minerals, main function of them, briefly, deficiency symptoms, dietary sources, and any toxicity or toxicity symptoms. And you could fill them out like this. It's a good practice to kind of even doing the research to put together like something like this, right? Even though in this day and age of information everywhere, it still is a good idea to make your own kind of collections of information, right? In the way that you know that you could learn things. And we're building our knowledge inventory of these 40 or so essential nutrients. That means we don't make them or don't make them in sufficient amount that they're called essential. And many of them, of course, we're not going to be making things like minerals or electrolytes. Some of the amino acids, those are the essential ones there, those 9. But we use 20 of them, so we make the other 11 from those essential ones. Vitamins, we don't make many vitamins. A few are made in our lower intestine with the help of bacterial, our microbiome friends. Um, and we need our energy sources, of course, those carbohydrate and fat mainly, and protein, less for energy, more for the amino acids of building things, putting things together. We know we have 2 essential fatty acids that we make a whole bunch of other ones when we're making things like cell membranes and uh, things like that. Okay, the other chapter 14, kind of a fun one. That's fitness and physical activities and nutrients that are absolutely necessary. Nothing super new there. Body adaptions, similar to if we're missing out on, there was a test question last test on if we stop eating or consuming our macronutrients, what happens? What happens? What's the sequence? So we use up all our glycogen. We use what we have on hand. We use the glycogen, and we go to adipose stores, which are not exclusive. We always are using a mix of carbohydrate and fat, just like our combustion engine uses a mix of gas and oil. But we use that glucose store first. That's a majority, along with some fat. Then when that's gone, we use strictly fat. But we run into a problem in that we don't have glucose, so we need to make glucose somehow, glyconeogenesis from um, uh, things like the backbone of triglycerides, like glycerol. We uh, can make glucose from that. We could also make glucose from certain amino acids. And the need for glucose is because our brain needs glucose for energy, and our certain nerve systems and red blood cells, and not having those makes it difficult for them to uh, use other fuels. Ketones come in the picture, but not for long periods of time. So let's see, there's some extra things in here about fitness. Is ATP, that we continuously make ATP. We know that from our earlier chapter. There's also in muscles, we have a certain amount of a different kind of, we have creatine to make this CP, which is another high energy source. Okay. And the other chapter starting on life cycle, nutrition, set, pregnancy and lactation, some of the uh, basics, and some of the nutrients that are very important during pregnancy and lactation, things like folic acid or folate or same thing, folic acid, folate, and that's very important for development of fetuses, neurotubes, spine, and so that's we learned that back in the um, vitamins chapter. Exercise during pregnancy, important, of course, a balanced diet, sufficient intake of calories, some of the um, uh, behaviors that should be minimized or excluded from activities, things like smoking is not a great idea, not a good idea at all, and alcohol, not a good idea during pregnancy. And during lactation, some special things are, of course, hydration and calcium, um, and a well-balanced diet. Again, during high-risk pregnancies might be a low birth weight of an expected mother. Okay. Okay. We have as a set of questions, possible questions, but also make us think. So I go through these just as a review. Some of them are coming from before, but still relate to our current 4 chapters. This we should always remember. Always, sometimes I like to throw in a question that you should not miss, but it's also a reminder of certain vocabulary that you absolutely need to remember. For instance, this one, all chemical reactions in a cell, the sum of them is metabolism. Catabolism is building something, like building a protein, digestion. Homeostasis, the body tries to keep stable in terms of temperature, hydration, um, having a pool of amino acids so that we're always making protein. It's interesting to think we are always making some protein, whether it's antibodies or whether it's enzymes or whether it's hormones or whether it's muscle. We're always making protein at all times, so we need those essential amino acids at least, and probably a lot of those other ones, the 20 amino acids, to have a pool there to continually making protein. We also need, of course, energy to fuel that process. And osmosis, we mentioned what osmosis is, that chemical process of movement of water across semi-permeable membranes to equilibrate the concentration of solute on both sides of a membrane. And this about a vitamin, even though this chapter is not vitamins, but they're always a vitamin is not inorganic. But what are inorganic, and it's a good time to make sure that we tell this difference. Minerals, those are all inorganic. They're all can be found on the periodic table. They're just elements. However, lots of times when they're used in the body, they're part of or used intimately with organic substances. For instance, iron, its place in hemoglobin is right in there, in the quaternary protein. It's right there. Very important part of carrying oxygen back and forth and CO2 out. Okay, most of the weight of our body is water. It's interesting to think, because I teach environmental science also, and when we talk about water, about 70% of the Earth is also covered with water. So you could say it's not the whole Earth, but at least covered with water, similar to our body is 65 or 70% water. Interesting. Iron-containing compound carries oxygen, that's the hemoglobin. These others are also organic substances to do with moving iron around or having iron as a constituent. Myoglobin is protein make up muscle that has iron in them. Transferrin is how we move around iron, and ferritin another storage way that we could store iron. Oh, that's a duplicate. Water makes up most of our, and that's another duplicate. Okay, electrolyte and water balance in the body is maintained by, and we said this, so undoubtedly something like this beyond the test, and that's osmosis, electrolytes and water. We think of the chemical process of osmosis, which is not a property of electrolytes. And so electrolytes, they do attract water, they keep water balanced, they are charged, and they can carry an electrical current. They don't include fat soluble. Um, they're not fat soluble um, particles. They're water soluble particles. And I think we mentioned this too, a pituitary hormone that um, regulates the retention of water. That's the um, ADH, antidiuretic hormone. Nutrients and oxygen are transferred from the mother to the fetus through the umbilical cord. BMI, a woman with a BMI of less than 18.5. Okay, so if you remember some of these numbers, so that's low. That's saying that that's a very low BMI, and that's in fact underweight, the category of underweight. The sweet spot is in the mid low 20s as far as the BMI. Remember, it's a gross kind of parameter that might suggest our current health and future health. It's not a rigorous diagnosis at all, but it's just because it's two simple measurements, um, and it's something simple and could be made more important than it should be. But BMI is something that's it's a valuable kind of gross parameter, right? It's weight and height. Okay, so a woman who are underweight, what it's saying what is it able to support normal, um, have less risk, more likely to have preterm at risk of medical complications. So it might be of some concern, and it might be more of a chance of a premature delivery than a what's considered a more healthy BMI. A baby is affected by gestational diabetes in the following ways, except. Okay, so this is not an uncommon occurrence, this gestational diabetes, and um, but it is some sign that the fetus is likely to have diabetes at birth. It doesn't mean that that will continue. It doesn't mean that the baby will have type 1 diabetes, because that's what that would be. Um, maternal calcium absorption during pregnancy. So this is a wonderful, a wonderful thing that during pregnancy is absorption of calcium, uh, this critical mineral for bone development is the absorption doubles, meaning that the woman does not have to take massive amounts of take in massive amounts of calcium to try to ingest rather to get what's needed, because absorption doubles. Absorption of calcium is not the greatest. It's maybe 50 to 70% absorption rate, uh, and don't have to take supplements usually. So it's fortunate that the absorption doubles. Nutrients that are important to prevent anemia. So this was we studied this a little bit back in the vitamins chapters, but it's not just folic acid or folate. It's iron, of course. Folic acid is important for development of protein that that uses iron. That has iron that's in metallo enzymes or um, red blood cells mainly. Because iron supplementation inhibits its absorption. Okay, so we don't absorb iron supplements as well as in naturally occurring iron in foods. Pregnant women should be careful to consume enough zinc. So some minerals that may be kind of similar in terms of their size and other properties um, might inhibit the absorption of uh, a similar mineral. That's the case with iron and zinc. If there's a lot of iron from a supplement, then zinc metabolism might be hindered, and that's what this question's about. Zinc is also very, very important in uh, operation normal behavior of the pancreas, such an important hormone generating organ. Malnutrition during pregnancy is not known to cause which of these. Malnutrition during pregnancy, not known to cause which one of these. So reading questions slowly, making sure there's no little curve in there. In this case, really thinking that, okay, it says not known, and it's also in bold there. Just to make sure we're thinking right, and then we scan the questions, the answers, of course, and then whittle it down, throw out the ones that we think are obviously not a possible answer. Okay, increase the risk of so it's not uh, risk of obesity, child later in life, increase the risk of type 2 diabetes, increase the risk of osteoporosis. So malnutrition, of course, is very, very general. We don't know if that means um, missing what kind of nutrients, or malnutrition sometimes could be even overnutrition. And in this case, it's it's this isn't connected at all. It's not not known to be something that could increase the risk of osteoporosis. Osteoporosis is accumulates over a long period of time, decades, and it's known as a very slow killer. So killer is a bit harsh, but it's one of those things that really develop over a long period of time. And of course, it's deterioration of the strength of bones, and it's hard to reverse after a certain um, loss of bone density and health. It's hard to reverse that osteoporosis. And softened bones, of course, result in falls that could be serious and other structural related um, problems. So that means malnutrition during pregnancy uh, can cause these other things. It's type 2 diabetes, obesity, decreased risk of uh, obesity could be increased heart disease. Nutrient requirements for pregnant teenage girls differ from pregnant women, adult women, because teenage girls are still growing. Okay, that's uh, that's true. Uh, Nutrient requirements, teenage girls, um, because they are still growing and need the nutrients, first of all, to completely develop, whether that's uh, bones, muscles, whatever, and then uh, being pregnant, that's going to be different than a adult woman that's pregnant as far as nutrients. Okay, we said alcohol's definitely something that should not mix with pregnancy. During first 6 months lactation, women's calories increase. So this is per day over the non-pregnant lactating. So when we think of normal kcals or calories with a large C, we're thinking the average, and that's what's nutrition labels based on 2,000 calories, 2,000 kcals. And we know that uh, during the first 6 months of lactation, we know that this probably you need an increase in calories because you just the production um, of milk for lactation, and so a reasonable number would be something like 300. It's not going to be uh, too huge, so this is middle of the road, and I don't like uh, questions, so probably won't be able to question this specific, but it's good to have kind of a feeling for. Um, this is per day, so 300 calories. So that's like maybe a 10%, 15% increase in kcals per day. All right, recommendation for solid food. Uh, Actually, this question is not in pregnancy lactation. This is in our next chapter, actually. But solid food is 4 months. So honey, I'm beginning to see this is some of these questions are for the next chapter. Honey is one of these things that yes, could carry because honey is very viscous and it could create an anaerobic environment if it's contaminated with um, certain anaerobic organisms that could produce botulism. That's so that's why it's not advised to have young children have too much honey or honey at all, especially under age of 1. Clostridium botulinum, that soil organism that produces botulinum poison. Dietary guidelines recommend that pregnant women avoid consumption of any food because of the risk of exposing the fetus to mercury. That's false. Uh, Fish is very healthy meat. It has essential fatty acids. It's low in saturated fat, so it is a healthy food. There is a risk for any of us exposure to small amounts, tiny amounts, maybe very, very small amounts of mercury. It's not in all fish, of course. It has to be from contaminated waters. Um, and some physicians might advise only once or twice a week eating fish, but that's uh, not a overall conclusive statement. But certainly, it's not avoiding fish consumption completely. Although very low birth weight infants have the risk for illness and early death, low birth weight infants have the same risk as normal weight infants. Okay, so there is more of a risk of certain um, certain things with very low birth weight. So it's making a distinction between very low and low to normal. It's not the same risk. Very low risk. Very low birth weight has more risk than low and normal weight infants. All right, compared to non-pregnant, non-lactated, a woman lactating needs increased amounts of all except, so we mentioned calcium is absorbed better, about twice as much bioavailability or absorption capability of pregnant women with calcium. Otherwise, pregnant women need more of a lot of nutrients, um, but not calcium. Breastfeed infants should consume about 55% of their calories as fat, and compared to 23. Okay, so we know that we are recommended to stay in the range of 20 to 35% of our calories from fat. That's kind of a normal range of macronutrients. Remember that. That's uh, the recommended range of um, and for breastfeeding, um, that the amount of fat should be higher. Once a woman knows she's pregnant, she should stop exercising? Absolutely not. Exercising is important for everyone, um, and and you got to figure out what works, of course. That's our talked about that in the last chapter. It's got to be fit into so that it's a habit that's made, that it works, and regular and part of life. It's a definitely uh, a positive addiction. Children's energy and protein requirements generally, sorry, this is the next, but that does increase and then decrease in adolescence. This is for next chapter. This one got in there. This one also might be going into questions that are not applying to the chapter 14. So might be so again, this is for next chapter. Lead toxicity is more common in low income. That's true, unfortunately. Adults have higher energy needs than teens. Okay, so adolescence is our next life cycle chapter, adolescence and young adults. And I'm sorry, but that's where we're going here. Uh, so I think that's the end of the questions I had. Just kind of look at a few more. Yeah, these are all adolescents where we look at this too. This is for those that have children, that you look at these charts to see if BMI, another, again, it's a gross kind of monitoring normal growth and to follow these curves. All right, I'll just end here and I'll at least put this question again on one of the two final ones, and we should all know that there are about this 40 number that we know of now. There might be some other nutrients that we get that we don't, we haven't kind of discovered yet. There are some nutrients that were considered indispensable. Uh, there was a vitamin P that was for capillary health and P for permeability. It's still known that certain phytonutrients that come along with vitamin C, I know this because I worked on this in graduate school, the flavonoids. Flavonoids are a class of phytonutrients or compounds in plants that have some synergy with vitamin C in capillary health and blood flow. But in about 1950, um, it was determined that we're not sure enough to call these vitamin anymore. So we're scrapping the whole idea of vitamin P. Also, it wasn't any specific, which is always a problem with um, that. Probably there's synergy among multiple compounds that act as uh, that we need, but we always like to state it's a single entity that is a vitamin or a drug and these kind of things. And it's probably combinations of things, like much of so-called folk medicine is very worthwhile, but it's harder to state things emphatically. That's combinations of things. Okay. I think we'll end there. And any questions or comments, certainly always feel free to send me an email or ask that can we talk. That's what I have these for, live WebExes. If it's good that if at least a few people show up, but not necessarily, because this is recorded for anyone that wants to look. I'll post it. I'll post it as soon as I can, as soon as it completes putting together. I'll post it, and I hope it's been healthy, helpful. Okay. Uh, and so if there's nothing else, we'll just stop this here.